Welcome to the overview of the National Center on Substance Abuse and Child Welfare Specialized Technical Assistance Programs. This video is intended to provide background information about the National Center on Substance Abuse and Child Welfare and its two specialized technical assistance programs, In-Depth Technical Assistance, or IDTA, and Regional Partnership Grant Programmatic Technical Assistance, or RPGTA. Lessons and successes from these two programs will be highlighted in the upcoming panel discussion on July 14th, Improving Systems Through Collaboration, Top-Down or Bottom-Up, both, from 10:30 to noon Pacific, 1:30 to 3 p.m. Eastern. This facilitated discussion will examine how sustaining systems-level change maximizes implementation efforts and ensures programs remain effectively and equitably delivered and sustained from the top down and bottom up. This presentation was developed by the National Center on Substance Abuse and Child Welfare, an initiative of the Children's Bureau, Administration for Children and Families, or ACF, co-funded by the Substance Abuse and Mental Health Services Administration, or SAMHSA. The views, opinions, and content of this presentation are those of the presenters and do not necessarily reflect the views, opinions, or policies of ACF, SAMHSA, or the U.S. Department of Health and Human Services, HHS. Visit the National Center on Substance Abuse and Child Welfare's website at http://ncsacw.acf.hhs.gov or contact by email at ncsacw@cffutures.org. The National Center on Substance Abuse and Child Welfare, in operation since 2002, offers training and technical assistance, or TA, to tribes, states, counties, courts, and community-based agencies to improve cross-systems collaboration and improve outcomes with equity for children, parents, and their families. The goals of the National Center on Substance Abuse and Child Welfare are to facilitate healing and recovery among children, parents, and families affected by substance use and mental disorders and involved with or at risk for involvement with the child welfare and family judicial systems. Promote the social and emotional well-being of children who have experienced maltreatment, exposure to violence, and/or trauma due to parental substance misuse, and advance racial equity and support for underserved communities and improving access for special populations, including tribes. TA includes resource development, cross-systems training support, consultation with content experts, development of tools to improve and sustain collaborative partnerships, and long-term intensive consultation with states, tribes, and jurisdictions to support systems change. Collaborative practice is a systems change approach that considers both systems-level policy efforts as well as practice-level strategies to improve family recovery, child safety, stability, and well-being. An intentional focus on equity in collaborative practice is necessary, especially as communities develop policies and practices that ensure children and families with the most significant barriers to timely permanency receive quality services. Applying an equity lens in collaborative policy and practice requires active and ongoing attention to eliminating disproportionate access to services and supports and disparate outcomes for all families. The National Center on Substance Abuse and Child Welfare facilitates systems change that leads to sustained policy and practice improvement and reduced stigma related to families affected by substance use disorders, or SUDs. Systems change occurs through enhanced agency collaboration based on a shared understanding of the needs, challenges, and strengths of families and the systems that serve them. The National Center also identifies and compiles key information and shares examples of successful programs with other jurisdictions to expand best practices in communities nationwide. Consultation and TA are designed to provide information, resources, best practices, guidance, and effective strategies. Training and technical assistance is guided by Children and Family Futures Comprehensive Framework, which was developed over several decades of experience working with hundreds of collaborative partnerships and operationalizes the complexity of collaboration into concrete areas of action. This framework offers a set of proven practice and policy strategies for communities and state leaders to implement to improve outcomes for families affected by substance use disorders, or SUDs, and involved with child welfare services. The framework details 5 practice strategies and innovations that lead to improved outcomes for children and families, which are early identification of families in need of SUD treatment, timely access to assessment and treatment services, recovery support, family-centered treatment, and frequent monitoring and responses behavior. The framework then defines 5 systems-level policy efforts that build a strong multi-agency collaborative team that is required to implement and sustain innovative practice strategies on behalf of families. Those efforts are a shared mission, vision, and goals, efficient cross-systems communication, ongoing cross-training and staff development, sustainability and institutionalized practices, and measuring and monitoring outcomes. These practice and policy strategies lead to 5 key shared outcomes for families, which are recovery, parents access treatment more quickly, stay in treatment longer, and decrease substance use. Remain at home. More children remain at home throughout program participation. Reunification. Children stay fewer days in foster care and reunify within 12 months at a higher rate. Repeat maltreatment. Fewer children experience subsequent maltreatment. And reentry. Fewer children re-enter foster care after reunification. We will now take a closer look at the specialized technical assistance programs under the National Center on Substance Abuse and Child Welfare, the first being the In-Depth Technical Assistance Program, or IDTA. Since 2003, the National Center on Substance Abuse and Child Welfare has provided IDTA to 29 states, tribes, and counties. The map on the right side of the screen illustrates current IDTA and Brief Focused Technical Assistance, or BFTA sites. IDTA is a unique program that provides jurisdictions with a customized package of expert assistance, consultation, and support over an extended time period. The IDTA program also offers Brief Focused Technical Assistance, or BFTA, to assist jurisdictions with a specific focus such as cross-systems training to educate partner agencies on substance use disorders and plans of safe care. The IDTA program focuses on responding to the needs of infants and families affected by prenatal substance exposure and the recovery of pregnant and parenting women and their families since 2014. This includes assisting states to develop policies and protocols to implement the 2016 amendments to the Child Abuse Prevention and Treatment Act, or CAPTA, related to infants identified as being affected by substance abuse or withdrawal symptoms or a fetal alcohol spectrum disorder. IDTA staff support selected sites to increase their capacity to improve the safety, health, permanency, well-being, and recovery outcomes for families affected by substance use disorders, or SUDs. The program achieves this objective by assisting states, counties, and tribes to build linkages among SUD treatment systems, child welfare and court systems, and public health, healthcare, early intervention, and other systems and agencies serving children and families. The foundation for the IDTA program approach is the comprehensive framework mentioned earlier to enhance collaborative practices for families involved in the child welfare system. The IDTA program uses the framework to assist states, counties, and tribes to identify priority areas for strengthening collaborative practice. The 5 points of family intervention developed by Children and Family Futures is a model that identifies 5 major timeframes when family intervention can prevent or mitigate the potential harm of prenatal substance exposure. As the IDTA program has assisted sites with implementing plans of safe care and the broader needs of infants and families affected by prenatal substance exposure, the 5 points of family intervention identifies opportunities for collaborative partnerships to strengthen services and supports across this developmental continuum. The intervention points illustrate the need for cross-systems collaboration, as no single system has services, supports, or strategies across this continuum. The focus in pre-pregnancy is preventing substance use disorders before an individual becomes pregnant through promoting public awareness of the effects of substance use, including alcohol and tobacco, during pregnancy, and encouraging access to appropriate substance use disorder treatment. During the prenatal period, the focus is on identifying substance use disorders among pregnant individuals through screening and assessment, engaging women into effective treatment services, and providing ongoing services to support recovery. At the birth event, it is critical to identify and meet the needs of infants affected by prenatal substance exposure, withdrawal symptoms, and fetal alcohol spectrum disorder, including the immediate need for bonding and attachment with a safe, stable, consistent caregiver. The focus during neonatal infancy and postpartum is on ensuring the infant's safety and responding to the needs of the infant, parent, and family through a comprehensive approach that ensures consistent access to a safe, stable caregiver and a supportive early care environment. And during childhood and adolescence, using a comprehensive family-centered approach to focus on identifying and responding to the unique developmental and service needs of the toddler, preschooler, child, and adolescent who is prenatally exposed. Next, we will take a closer look at the Regional Partnership Grant, or RPG program. The Child and Family Services Improvement Act of 2006 reauthorized the Promoting Safe and Stable Families, or PSSF program. This legislation provided funding to implement a targeted grant program to regional partnerships to improve permanency outcomes for children affected by methamphetamine and/or substance abuse. This legislation was a direct response to the evidence that parental substance use is a key factor underlying the abuse or neglect experienced by many children in the child welfare system. The Children's Bureau has awarded a total of 109 funded projects in 6 rounds in 38 states and 391 counties. 9 grantees have served or are serving primarily American Indian and Alaska Native families. The map on the right side of the screen shows RPG rounds 1 through 6 grantees by state. To learn about funding opportunities, visit the grants.gov webpage. The Regional Partnership Grants, or RPG Programmatic Technical Assistance Program, focuses on enhancing the region's capacity to meet a broad range of needs of families involved with child welfare, SUD treatment, and the courts. The purpose of the initiative is to increase well-being, improve permanency, and enhance the safety of children who are in or at risk of an out-of-home placement due to a parent's substance misuse, and to provide activities and services through interagency collaboration that include a focus on race equity and support for underserved communities. The RPG program also seeks to expand the evidence base of programs and practices in the fields of child welfare and substance use disorder treatment by requiring grantees to identify and use appropriate practices that are indicated by evidence to be well supported, promising, or emerging practices, adapt these practices for the children, parents, and families they serve where appropriate, and implement and participate in local and cross-site evaluation of the grant program to expand the evidence base of services for families involved in the child welfare and substance use treatment systems. From 2007 through 2021, the RPG program has served over 41,000 children, 31,000 adults, and 25,000 families. At the core of these 2 specialized technical assistance programs, we understand that collaboration across multiple systems, coupled with strong leadership and consistent communication, offers a more efficient and effective approach that ultimately leads to better outcomes for families. During the upcoming panel discussion on July 14th, you will hear firsthand from IDTA and RPG grantees how they have applied these and other lessons to improve practice and policy and make lasting systems change. Although there are some differences among the lessons of IDTA and RPG, there are some common experiences. Both TA programs acknowledge the importance of a clear screening process that leads to early identification of and intervention with infants, children, parents, and family members, a strong and formal governance structure to guide policy and practice decision-making and prioritize sustainability, intentional and frequent review of relevant cross-systems data, inclusion of family voice, and use of peer support specialists to engage and support families. To give you a glimpse of what you'll learn during the live panel discussion, here's some information about peer recovery support. This program strategy is best exemplified through the integration of peer or recovery specialists as part of the collaborative effort to identify and meet the complex needs of families. Peer specialists often have personal experience with substance use disorders or child welfare involvement. Recovery specialists are professionally trained in substance use disorder treatment and recovery. These experts can facilitate timely access to substance use assessment and treatment, foster engagement during and after completion of treatment, and support child welfare caseworkers and court professionals to better understand the treatment and recovery processes. By highlighting their experiences and how they carry out their work, peer recovery staff can promote the key role of peers in engaging families, assisting them as they navigate the child welfare system and supporting their recovery journey. This short video testimony illustrates this approach.
I've been a peer recovery coach with Trumbull County Children's Services since July 2nd of 2018. I share a caseload with 2 caseworkers. One of them is designated for family dependence and treatment court. The other caseworker I share a caseload with is dealing with families who have infants directly affected by substance use disorders. It has been overall an amazing experience working with the team. There's very different perspectives on the team. And I think that, bringing my perspective to the table has been so new, but so well received. I was the first peer support on treatment team a little over 2 years ago, and a lot of people were unsure of what I would bring to the table. I think I was a little unsure myself, but I think with my lived experience, I was able to be a voice to our clients and team. I was able to help the team really truly understand what recovery looks like for those that I'm working with. It's such a wide dynamic of, different lifestyle choices and behaviors and attitudes. Recovery is something that isn't achieved overnight, not even in a year. And for a lot of individuals, that looks differently, what that process can look like.
As we have learned about the work of the National Center on Substance Abuse and Child Welfare, the specialized technical assistance programs it operates, and the comprehensive framework built from decades of work with collaborative partnerships, we know this. Compared to efforts by individual agencies, collaboration across multiple systems, coupled with strong leadership and consistent communication, offers a more efficient and effective approach that ultimately leads to better outcomes for all families. Implementing and sustaining improved practice and policy changes on behalf of families requires building capacity to work collaboratively across systems at the local and state level. Thank you, and please contact the National Center on Substance Abuse and Child Welfare to connect you with programs that are developing tools and implementing practices and protocols to support their collaborative, and training and technical assistance to support collaboration and systems change. Visit our website at http://ncsacw.acf.hhs.gov. Email us at ncsacw@cffutures.org or call us toll-free at 1-866-493-2758.